Hello, I'm Karen Slayton. This is a recording that I am making for the Brain Longevity Training Specialist certification. And I'm going to talk to you today about the importance of sleep. A quote from Time magazine says, if every one of us slept as much as we're supposed to, we'd all be lighter, less prone to developing type 2 diabetes, and more likely better to equip the battle of depression and anxiety. We might even lower our risk of Alzheimer's disease, osteoporosis, and cancer. That's a pretty big statement and tells you of the importance of getting sleep. So how much sleep do you actually need? The average adult needs about 8 hours, some people more, some a little bit less. But without a sufficient amount of sleep, we know that individuals have impaired judgment and slower reaction time. They're more prone to gain weight. There's brain aging due to inflammation. And unfortunately, at least half of people 65 years of age or older experience frequent sleep problems. And sleep problems can be associated with depression, dementia, and delirium. And just in general, lack of sleep makes our quality of life so much worse. Your brain needs sleep too. It's as necessary for our survival as food and water. Being awake for 17 hours is in fact similar to a blood alcohol concentration of 0.05%. And at 24 hours, that increases to 0.10%, which suggests that our impairment is pretty significant when we've missed sleep. Poor sleep is also tied to a higher risk of heart disease, high blood pressure, obesity, and stroke. Now, sleep is important for us in making memories. It's really fun because when I was doing my doctoral training, I learned that if I would read over my notes right before bed, somehow my brain processed the information a little bit better. Didn't really understand that completely at this time, but now we know that everything that we see and do leaves a neural trace in the brain. Long-term memories are recorded and organized during our sleep. Too much sleep, greater than 9 hours, and too little sleep, less than 5 hours, is associated with poor cognition and brain aging. Something else happens when we sleep in our brain. The brain creates waste during the day as it works, and this needs to be cleared away during sleep. So beta amyloid plaques that accumulate are associated with cognitive decline and Alzheimer's. So you can see how important it is for our brains to take out the trash every night to get rid of those plaques that accumulate. It's also a vicious cycle. Poor sleep causes the plaques to build up, and then the buildup disrupts sleep and impairs our memory. So sometimes we're tempted, and very often my patients reach out to providers asking for medication for sleep. Things like Valium, Xanax, Ativan, benzodiazepines, or other sleep medications that really are not healthy for people, particularly as we get older. There's a risk of dependence, and it also increases the risk of Alzheimer's disease. So what does work? There are several things that work very well in practices called sleep hygiene that can assist you in getting a better night's sleep. Exercise is important. It's important for so many things in our life, but it's also important for assisting with your sleep. It improves your circadian rhythms and your alertness during the day and sleepiness at night. Something like taking a walk for 30 to 45 minutes at a moderate pace early on in the day or by early afternoon is a great way to get this started. And then practicing a gentle yoga stretching at night before bed can help you unwind and be prepared for your night's sleep. If you find that you're in bed and you're having a difficult time going to sleep, we recommend that you practice a relaxation, something such as 4-7-8 breath, where you breathe in for 4 seconds, hold it for 7 seconds, exhale for 8 seconds, something like that, or even just taking deep breaths that take your breath all the way down into the lower lobes of your diaphragm so that your belly expands, and fully exhaling all of that air. That can work too if counting your breaths feels a little bit awkward. But breathing can relax the body, and gentle yoga stretches. We do recommend exercise earlier in the day to help you with sleep, but yoga can be done at any time just to get that good feeling in your body. We also encourage you to go to bed at the same time and get up at the same time every day, even on the weekends. And if you're someone who enjoys sleeping in on the weekends, I'm definitely one of those people. That's okay if you're not having sleep problems, but if sleep is an issue for you, you can see by what I've already said that it's critically important for your health. So give it a shot for a while. Go to bed at the same time, get up at the same time. Having nighttime routines is beneficial too. So if you remember when you're putting your kids to bed at night, they loved that routine, and sometimes by the end of the routine, their little eyes would be getting heavy and they're falling asleep. Well, as adults, we're the same way too. We need to be able to have a routine that lets us know that our day is ending and we're getting ready for bedtime. So things such as doing some gentle stretches, doing a meditation, diaphragmatic breathing, taking a warm bath, reading something from an actual paper book that's not too activating can be ways to help you wind down. Sleep, the position that you have when you sleep can also help with falling and staying asleep. Side sleeping is generally recommended. And I want to take a moment just to say something about those of you who are caring for other people. You use up a lot of your energy, your physical, mental, spiritual energy, giving to another person that you're caring for. And oftentimes that leaves you feeling exhausted, which can lead to poor sleep. Especially if you're not able to care for yourself, getting physical activity, getting adequate food, getting adequate stress relief, those things can make a big difference in how well you're able to care for yourself. And it's like we say, that like we hear on our airline flights, to put your own mask on first. And that's important for caregivers, is if you're not taking care of yourself, if you're not getting your sleep, getting your physical activity, you're not going to be in the best position to take care of other people. So remember to care for yourself first. Put your own mask on first. We'll talk about a few more tips for better sleep. Keep your bedroom cool. 68 to 72 degrees is ideal. So we like to sleep when it's cool and dark. Turn off all electronic devices 2 hours before bed. And so many people have televisions or clocks or other appliances in their bedroom, and you may not notice this right when you go to bed, but as it gets darker in your room, you may notice that those lights actually put out quite a bit of light. So getting some dark color masking tape and covering those lights can reduce the amount of light in your room and keep it dark. And if you're someone who has bright windows, I live in an urban setting. I have huge windows and I get light all day and all night. I sleep with an eye mask, so that can be another way to make your room stay darker. Light stretching, gentle exercise, relaxation, breathing techniques can help as well. Not drinking caffeine after 2 p.m. Keeping a gratitude journal but right before you go to bed, think of the things that you're grateful for from that day to put yourself in a good mindset as you're going to bed. And then drinking some sleepy time tea, eating foods like turkey, things that have tryptophan in them can actually help you go to sleep at night. I encourage you, however, to eat very lightly before bedtime. Eat your biggest meal about, early evening, and then just have a light snack before bedtime. And finally, if you get in bed and you find that you're not able to go to sleep, after being in bed for 15 minutes, get up out of the bed, go to another room and engage in a quiet activity until you feel sleepy again. And something great to do is a progressive muscle relaxation, breathing. You can find a lot of these recordings many places on the internet, but I always recommend to my patients the Cognitive Behavioral Therapy for Insomnia smartphone application. It actually takes you through an entire course of treatment for cognitive behavioral therapy for insomnia. But what I like on there under the tools section is you can find some ambient noise if you like white noise when you're sleeping, but you also find guided imagery, progressive muscle relaxation, breathing, and those are easy activities. You can click on that app, find your favorite recording, sit quietly in a dark room and just listen to it until you get sleepy again. So hopefully this helps you learning a little bit about the importance of sleep and taught you a few tips and tricks for achieving that for yourself. Hope you all have a wonderful day and sleep well tonight. Thank you.